If you're experiencing early signs of hip arthritis and you're looking for some simple and effective ways to manage your hip pain with physiotherapy, this video is for you. I'll be sharing some effective ways to manage hip pain with simple physiotherapy exercises you can do at home to ease symptoms. We'll also look at what sorts of exercises to avoid and at what point to seek specialist support. Hi, I'm Mark. I'm the physiotherapy manager at Chiltern and Chiltern Hospitals. More often than not, by catching hip pain early and knowing what the best exercises are to ease and manage your symptoms, there is little need for further treatment. I'm going to explain why you should embrace movement and exercise, as well as give you 5 effective exercises that ease hip pain specifically related to arthritis. You might be avoiding exercise because of your hip pain, but actually, exercise such as strengthening and mobilising your hip may reduce your symptoms. Pain around your hip might weaken your muscles, so strengthening them is a really good idea. Also, your hip might become stiff from lack of movement, so you should stretch as well. If you've got hip pain, some of your muscles might be weak and some of them strong. By doing exercises, you'll restore the natural balance of these muscles, making the hip work as it's supposed to. It may seem counterintuitive because you've got discomfort, but in time, exercises which strengthen and mobilise your hip will make you feel more comfortable. This will also preserve the life of your hip joint. At what point should you speak to a physio? Well, it depends on whether the pain is mild. Gentle exercise can be enough to see a big difference. If the pain in your hip is worsening, if it's affecting your sleep, if you're using increasing amounts of painkillers that aren't working, basically, if it's all worsening, I'd advise you see someone. If you've got hip arthritis, you may eventually need a hip replacement. The exercises I'm about to show you are not only going to prolong the life of your hip joint and ease the pain in the run-up to surgery, they'll give you a solid foundation for the best possible start to your recovery. These exercises should take a fair few weeks for you to feel the benefits, so stick with them. If they increase pain, then ease off and do these movements more gently. You most definitely want to avoid high-impact sports with arthritis. So, let's get into it. The first exercise I'm going to show you is bridging. This is a good exercise to do before you get out of bed in the morning. Lie on your back on your bed or on the floor if it's safe to do so. Bend up your knees and hips so your feet are flat on the ground. You can have your arms by your side or across your chest, that's up to you. Tighten your bottom muscles and slowly lift up as high as able and relax back down again. Like so. You can vary the speed at which you do your bridging exercises and they will feel slightly different and make the muscles work in slightly different ways. So now I'm going to show you the clamshell exercise. Lie on your side on the bed or the floor if it's safe. We want 45-degree angle at the hips, approximately 90-degree or right angle at the knees. And if you're able to see what's going on, you want to have your feet level with your back, like so, not too far in front of you or too far behind you. And you keep your ankles and heels together and separate your knees slowly. Avoid rolling backwards as you're taking the knees apart. There shouldn't be any backwards rolling movement in your body. It should just be your knees separating as far as you're able and nice and slow on the way down. And you will be feeling the muscle in your bottom just here on the top rather than down your leg. If you feel the muscle pulling down your leg, then just slightly adjust your leg position. The next exercise I'm going to show you is called hip abduction. Again, lying on the bed or on the floor if you're able to get up and down from the floor. It is done like this. Quite simply, you leave your bottom leg bent up and you straighten your top leg and take it away as far as comfortable, hold for a second or two and then slowly bring it down. If this exercise is too difficult for you lying on your side, I'll show you an easier version when you're standing up. If you're struggling to take your leg to the side when you're lying on the bed, this is an easier alternative. Stand with a firm support like a chair or kitchen work surface and take a painful leg to the side and slowly back down again. Repeat about 10 times. This should also be done on the other leg as well, if you're able to. Exercise number 4, turn the chair around and sit down, because this exercise is called sit to stand. So sit with your feet comfortably apart and flat on the floor and stand up and down again. Try not to use your arms to push from the arms of the chair. Try not to bend very forwards, just a comfortable, relaxed position of your back and all the work being done by your legs. Try to do this 10 times in a row. If you want to make it more difficult, slow the exercise down. If you want, you can even pause for a few seconds before you sit down. Slowly up, down, pause and relax and go again. So this is exercise number 5, the last exercise in the video. If you don't have a step like this, then use the first step of your stairs at home with support from your banister. Step onto the step and turn to the side. And what you're going to do is you're going to keep one leg in the middle of the step, have a bit of support for stability and step down to the ground with the other leg and come back up. This is a slightly more advanced exercises than the first 4. This is working on dynamic control of your hip whilst it's moving. So you've got your thigh muscles and your hamstring muscles and your bottom muscles all working together to achieve this movement without a lot of wobbling around. Try it on both legs as before, repeat 10 times on each leg. If you've tried these basic exercises and you're unsure as to why you're still experiencing hip pain, it's useful to know that you don't need a GP referral in order to see a physio at your local Circle hospital. Our team can help you work out if you need further treatment and can refer you on to one of our specialist consultants if you need one. If you have any questions or comments, we'd love to hear from you, so please comment below this video. We'd also like to know what kinds of videos would be helpful so we can share our best insights with you in future. Thanks for watching.